So they said that how can prostaglandins initiate and maintain labor? So now we are now going deeply into the obstetrics now. Okay, so how can prostaglandins initiate and maintain labor? Okay, so child labor, right? So prostaglandins is not all of them, it's some types that usually initiate and maintain labor. So we have the prostaglandin E2 and the prostaglandin F2 alpha. They are the ones that initiate and maintain labor. Now they do this by ripening the cervix. They soften the cervix, they make it wide enough, they dilate it. Okay, they stimulate uterine contractions, they enhance gap junctions formation in the myometrial. So this is what actually coordinates the contractions. So let's look at the detailed mechanisms of prostaglandins in labor. First is cervical ripening. So the prostaglandin E2 is the one that remodels the cervical connective tissue. So to increase collagen breakdown and water content, this will now makes the cervix very soft and it can widen up. Okay, so it's very important for the cervix to open, and this is what is usually used to allow for the passage of a baby when the baby is about to be born. Okay, so what's a membrane rupture? Next is membrane rupture. Prostaglandin will weaken the fetal membranes, that's the amnion and chorion. Okay, so that's basically the water bag. So when you hear them talking about the water has broken, it's because of prostaglandins. They make that bag to actually break. Okay, so that's what further progresses labor. Maintenance of labor, now that's uterine contractions, is done by the prostaglandin F2 alpha and also the prostaglandin E2. They are the ones that make the myometrial muscles to keep contracting. They increase intracellular calcium in uterine muscle cells, so they lead to strong rhythmic contractions. Okay, then gap junction formation, they promote the connexin 43 expressions. This will form gap junctions between the myometrial cells. That's what keeps the contractions stronger. Now, positive feedback loop, uterine contractions will stimulate further prostaglandins, leading to more sustained contractions. As the contractions are more prostaglandins being secreted, and the contractions are being maintained more. Okay, so clinical relevance is there are some 1 or 2 drugs that are in the form of prostaglandins. When you give it to a woman that is almost giving birth, then the drugs can start up contractions in that woman, or sometimes if you give those drugs, it can terminate pregnancy. Okay, so sometimes if you block prostaglandin activity, you can delay labor. Do you understand? So sometimes the baby has not reached the time that the baby should be giving birth yet, so the mother is showing signs of she will soon be in labor. So you can give some drugs that can block production of prostaglandins, thereby buying the baby some time and giving them time for their lung to develop more. Okay, so that's it for how prostaglandins can be able to initiate and also maintain labor.